going to demonstrate Foley catheter insertion. We have checked our orders, we have the right patient, we provided privacy, washed our hands, and we told our patient what we're going to do. Now the next thing you do is open your catheter insertion kit, and the outer cover is actually going to be used as our trash can, and we're just going to set it on the bed, and we'll put our betadine cotton balls that we dispose of, and everything will go into this trash can. Okay, we're going to open the tray away from us. This is going to be our sterile field. Okay, the first thing you do before you put on your sterile gloves is pick up your drape by the corners, shiny side down, and this is going to go underneath the buttocks on the female and then underneath the penis on the male. So this will be our sterile field on the bed. And then grabbing the center of the gloves, we can take those off our sterile field. Now we don't want to touch anything else. I'm going to move to the side and put on my sterile gloves. And even if they don't go on correctly, you can readjust them when you get them both on. Because usually they don't. Okay, now you're sterile, so you want to be careful what you touch. You can grab the center of your wrapper and toss it behind you without lowering your hands below your waist. Grab your kit, move it to the center of your table. And I'm going to rotate my box where the box with the Foley catheter and the bag is closest to the patient. There's another drape in your kit. It's the fenestrated pad. It's got the hole, the triangle in it. This can be used, but for simplicity, we are going to have all students use just the rectangle pad. Okay, your kit actually comes with the betadine, the cotton balls, the forceps, your lubricant, sterile specimen container if you need a specimen, and your 10 cc's of normal saline that we'll inflate the catheter bulb with. So what we want to do first, you want to open your betadine and put that on your cotton balls. Okay. You can just lay that down there, mix up your cotton balls and your betadine. And then open your lubricant, which you're going to lubricate your catheter tip with. And you can put it in any of the container or the openings in your kit is fine. And this we'll just toss into our trash can. So we've did our betadine, our lubricant, and now we want to test our catheter bulb to make sure it inflates. And I find it easier to leave it covered so you're less likely to contaminate it. We'll go ahead and attach that to your port and inflate your bulb to make sure it inflates and it's not leaking. And then once it's inflated, it's not leaking, go ahead and deflate it, but leave your syringe attached to your Y port. Almost deflated. Okay. Left the syringe attached. Now go ahead and you want to uncover your catheter, but be careful not to let it flop and hit something that's not sterile. Now you're going to place the catheter tip in your lubricant. Lubricate about 2 inches of the catheter tip, and you can go ahead and leave that in the lubricant, and that kind of holds it in place. Now at this point, what you're going to do is now your non-dominant hand is going to become contaminated, because you're going to use your middle finger and your thumb to hold open the labia. Then you're going to take your cotton balls. The first one's going to go down the center, one swipe, and toss it away. Then you can either go on the left side dispose of that one, and then the right side and dispose of that one, and then just throw your forceps in your trash container. Now I'm going to take my bag and my lubricated tip, and my kit's still sterile, so I can take it over here and put it on my sterile field on the bed, being careful not to contaminate my gloves. Now you're going to have your patient take a deep breath. And okay, you're going to insert your catheter. Be careful that you wouldn't want to touch your sterile hand to your patient as you're inserting it. Once you see urine in your tube, you can go ahead and insert it about another 2 inches. Then at this point, your non-dominant hand is going to come down and hold your catheter. This hand is now, it doesn't have to be sterile, and you can inflate your bulb. And if they complain of pain, you'd want to reinsert it a little bit more to make sure it's not in the urethra. It inflated fine. Disconnect your syringe. Then you're going to pull your catheter down to the base of the bladder. Take your catheter bag, make sure it is clamped closed. Hang it on a part of the bed that's not moving, just the bed frame, not the bed rail. Tape it to the leg of the patient, and then you're going to document any drainage, the color of urine, and how the patient tolerated it, and the size of the catheter. We have an order. We're going to DC the catheter on our patient. What we need is washcloths, towels, things that they can clean up with afterwards. We're going to have a new sterile 10 cc syringe. We've disconnected the catheter on the leg with the tape. You want to insert the syringe on your Y port. Deflate your catheter bulb. You want to deflate take out the whole 10 cc's of normal saline from the bulb. Make sure it's deflated all the way. Dispose of that. Just have them take a deep breath. Take the Foley catheter out. You wrap it in your disposable material. Then you want to dump or empty your urine from your bag, dispose of it, and record the amount. And monitor for urination, make sure they don't have any pain, discomfort, and give them the washcloths and towels to clean up with.